A normal day for clinical pharmacists would start with the rounds. So normally you check the charts of the patient. It's a fact that we cannot really handle the clinical pharmacy field for most of the patients here in PGH. So we only cater patients, only a few patients could be taken in for the program because you have limited numbers of clinical pharmacists and you have a lot of patients. So if you would imagine, a ward or a certain ward would have around 50 to 75 patients. And your clinical pharmacist in PGH will go on shifts. So if not, the ratio would probably be around 30:1. Okay, so it's not for a specific ward alone. So it's not going to be that easy for a clinical pharmacist to handle all of these patients. That's why they only choose or pick certain patients who needs primary care when it comes to the clinical pharmacy services. So on a normal day, we go on shifts or we go on rounds. We check the charts of the patient. We check the medications that they were given. If they have a new order, a reorder, a new order would be a drug that has been added to the list of the drugs being prescribed for the patient, which has not been added yesterday. A reorder would be a drug that would be given to the patient still for continuation. So you have to check those things. Upon checking, of course, you also need to look at the therapeutic sheets if the doses were given yesterday as what has been prescribed and as what you have been prepared. After that, after you go on the checking, then if the patient is enrolled in UDDS setup, okay, so you would be the one to do the reorder for them. So theoretically, that's how it works. But most often, sometimes we deal with patients with too much drugs that there are also sometimes that we can't afford to get to check these patients every day since there's so many of them. So upon also checking those drugs, we also need to check the doses if they are right. I mean, there are patients who have conditions that needs the doses to be adjusted. So you have patients with renal clearance, you have patients with kidney diseases, you have pediatrics, you have geriatrics, you have to consider doses. You have to consider those patients for them to have the right doses. Okay? And then we also need to check, of course, the compatibilities and the adverse drug reactions that could be possibly given to a patient, because these are sometimes the things that your doctors and nurses overlook at. It's going to be different from your other counterparts in the other countries, basically because the pharmacy practice here in the Philippines is based on money. It's not that patient-based. When we're talking about clinical pharmacy, it should be patient-based. It is patient-oriented more than drug-oriented. So it's a practice wherein you cater most of the time dealing with your patients than your drugs. We're going to look at it. The clinical pharmacist, especially here in a healthcare system or in PGH, would play an important role in such a way that it would somehow lessen the burden when it comes to the interactions with your nurses and doctors when it comes to your patients. The clinical pharmacist's role actually is, since it is more patient-oriented, it's more on looking at the things that sometimes the doctors and nurses overlook at. So you have details of the drugs that they give, your doctors prescribe your medicines, the nurses administer the medicines. But if you're going to look at it, what's going to happen in between? So sometimes there's sometimes we have missed doses, we have overdoses, we have errors, and those are some of the things that your clinical pharmacist would assume the place of. If we're also dealing with the unit dose drug delivery systems when it comes to the clinical pharmacist role. So there are some patients who are being given the type of service like a UDDS. So that's your unit drug dose delivery system. So the doses that they are taking are going to be on a daily basis instead of in a bulk. So that's one of the roles of the clinical pharmacist. Clinical pharmacist, this one is their office. Okay, so this is the office of the training and research. So the clinical pharmacist will stay here. There is a situated area for them in the central ICU, the central intensive care unit on the second floor. So the patients actually being taken care of for the UDDS or the clinical pharmacy practice are the patients under the central ICU. Those patients who are in the ICU that really needs utmost care. So you have pediatrics and normal patients there, unlike in other charity wards. So there are also patients in the pay ward. So that's the time that the pharmacist visits them on a daily basis to check on the needs of them. But there's no clinical pharmacist on the dispensing area or on the main pharmacy because the dispensing area is more concerned when it comes to the needs of the majority of the charity patients. As far as the main pharmacy is concerned, they will cater for the drugs that we cannot handle or for patients who are outpatients. So there are instances that they can buy their medicines there. The pay ward pharmacy would cater for, of course, the patients who can pay on the up floors. How many clinical pharmacists are needed for a duty? It actually depends on the unit. It depends on the hospital. It depends on the setup as to how many clinical pharmacists could they get. On a scale of the PGH, I think it's already hard for a clinical pharmacist to handle around 10 patients in a day. It's going to be already hard since one patient does not mean that the patient only has 1 or 2 drugs. Sometimes when the conditions of the patients are being too extravagant, or sometimes when you have other comorbidities, it also entails the use of more drugs than the usual. So some of your patients has around 10 drugs, 12 drugs, which you have to coordinate. You have to plan the schedule of the doses. You have to look at the drug interactions for each and every drug. You have to look at all of those little things so that you could really insert something when it comes to the clinical practice. On my part, I think one of the major situations where we are unable to practice well the field of clinical pharmacy is the openness of the minds of the other healthcare system. When we're dealing with the Philippine setup, it's not like the setup in the other parts of the world. In other parts of the world, clinical pharmacy is an accepted and welcomed profession. In the Philippines, it's not like that. So the clinical pharmacist here, most often than not, are just compared to your regular dispensing pharmacist. But at the same time, you also need to check on the openness of the doctors, for example, and the nurses, because these are the forerunners when it comes to the healthcare needs, because the doctors and nurses are the ones being seen by their patients. Okay, your clinical pharmacists are not seen actually by our patients because we don't have any interactions with them unless they would go for us for counseling. Okay, so one of the problems is, of course, the acceptance, of course, of your doctors and nurses when it comes to your recommendations, because when we see errors or when we check the things that they do, there are instances that they would also commit errors. And of course, if they're not too receptive to our recommendation, that's going to be a problem on our part. That's why we also have the pharmacist notes. So whenever we see to it or whenever we get the chance to have an error being incurred in the programs of your patients, we write down a pharmacist note for the doctors and the nurses. So we have to be polite as much as possible when it comes to recommending. So it's not like you're going to tell them, doctor, your dosage is wrong, this drug is not really intended for this patient, or hey nurse, this is not the dose that is required. This is too high. This is too low. It's not like that. So you have to respectfully endorse them the letter, the notes, so that they would be able to look at it that well. In the Philippine setup, especially in the Philippine General Hospital, they know naman that we have a clinical pharmacist. So most of the time when we have recommendations, they review it. So I guess that's one of the bottleneck when it comes to the practice of clinical pharmacy in the Philippines. I don't know in other hospitals, but I guess not all hospitals have their clinical pharmacists. I mean, it's not an established profession unlike in other countries.